In this video, you will learn how to respond to a bleeding nose. There are a few common causes for nosebleeds, which include dry air, colds and allergies, nose picking, or injury. A child with a bleeding disorder may experience prolonged nosebleeds, and so it is important to know how to respond to a bleeding nose. If your child has a nosebleed, follow these steps to stop it. Have your child sit or stand upright with their head tilted slightly forward, not back. You want to make sure that the child is not swallowing any blood. Pinch the soft part of the nose and hold continuous pressure for 15 minutes without peeking at it. If their nose is still bleeding after 20 minutes of constant pressure, seek medical guidance. There are different supplies to help stop nosebleeds too. This is a nose clip. Nose clips can be placed over the soft part of the nose to apply the pressure for you. Wear the nose clip for 15 minutes before checking. This is a nose bud. Nose buds should be kept frozen. During a nosebleed, fold the cold nose bud over the nose. Apply pressure over it for 20 minutes using either your fingers or a nose clip. If you do not have nose buds, a small bag of ice can also be used to apply ice and pressure over the nose. Another way to stop a nosebleed is using salt pork or bacon. This needs to be prepared before a nosebleed occurs. Cut strips of salt pork or bacon, roll, then tie with a string. Allow extra string to hang off, which will be used when removing. Keep these frozen and ready for when a nosebleed occurs. Push the salt pork bundle, still frozen, into the nose. The salt pork contains elements that help stop bleeding, and the cold also constricts blood vessels to stop a bleed. Once the pork is warm, carefully pull on the string to remove, being careful not to dislodge the clot. If bleeding slows but does not stop with ice and pressure, the use of vasoconstricting nasal spray, called Afrin, can provide additional help to get the nose to stop bleeding in children 6 years of age and older. Use 1 to 2 sprays in the bleeding nostril and return to treating with ice and pressure. This can be repeated 5 minutes later if still bleeding. Limit the use of the medication to only twice a day and not more than 3 days in a row. If your child is younger than 6 years of age, check with your medical provider before using. You now know how to respond to a nosebleed. This video is not specific to your child, but provides general information. If you have any questions, please ask your child's doctor or nurse.